Hello, my name is Dr. Matthew Kaplan. I'm the Director of the Emergency Department at Mission Viejo. We also cover Mission Viejo, Laguna Beach. I would like to reach out to all the community physicians and doctors and say thank you for everything that you are doing in our community to keep our patients safe. This past year has been a challenge for all of us. But fortunately, with the advancement of medications and vaccines, we may see an end to the COVID-19 pandemic, hopefully soon. Since November, we've been given a new arsenal to treat our patients with COVID. This is for outpatient treatment only. However, our emergency department saw the need for this medication and the need for the delivery of this medication, and we volunteered and stepped up to be able to reach out to our community to give this medication. This medication is called Bamlanivimab. It's a long word, but we like to call it BAM. What it is it is a monoclonal antibody that is used to decrease the viral load in patients. And by decreasing the viral load in the patients, we see that their symptom severity decreases. This medication is used for patients with mild to moderate disease in order to stop the progression to more severe disease. Studies were done, which we call the Blaze 1 and the Blaze 2 trials, which have shown that the use of BAM has decreased hospitalizations. BAM right now is not FDA approved, but in November it was granted emergency use authorization so that we could give it to a selected group of high-risk patients. And by doing this, we are showing decreased hospitalizations across the nation. So what we ask from our community physicians is that they screen patients for BAM. The earlier we give BAM, the better, as it is interacting on the viral load and decreasing the viral load. We don't want to wait for their symptoms to get worse before we elect to give this. For patients to receive BAM, they have to be 1, COVID positive testing, 2, symptoms for less than 10 days, 3, do not require any oxygenation or hospitalization, and 4, if they are on chronic oxygen, do not require an increased need of oxygen. There are mandatory requirements to administer this, and we do adhere to them. The other requirements which are listed are anyone who is over 65 qualifies, patients who have a body mass index of greater than 35, patients who have chronic kidney disease, patients who have diabetes, patients who have immunosuppressive disease, patients who are currently receiving immunosuppressive treatment, all qualify. Also, patients who are 55 and older can qualify if they have a history of cardiovascular disease, hypertension, or COPD, or asthma, or any chronic respiratory illness. There are very few side effects with BAM. They do include nausea, weakness, dizziness. We've had no serious side effects here at Mission Hospital, and we do track the patients by giving them call back within the next 1 to 2 days. If a patient does receive BAM, we ask that they do not receive a vaccine for 90 days post the infusion. When they receive BAM, we still follow our CDC guidelines of having them isolated for 10 days and until symptoms are improving and no fever. We've treated over 260 patients, which has likely saved over 20 admissions. Of those admissions, 40% would go to the ICU, 60% would go to the floor. When we look at that in terms of bed days, we would have had 8 patients who were in the ICU at a total of 25 days per patient. That's over 184 bed days in the ICU. We would have had 13 patients that would have been admitted to monitor beds for 5 days. That's over 65 days of bed days saved. We're not only saving the bed days, we're also saving the PPE and the resources, and more importantly, we're saving lives. We're also preventing long-term effects of COVID. By lessening the symptoms, we suspect that patients will have less long-term effects. We ask you as our community physicians to please evaluate this medication, evaluate your patients. We would like to treat them, and until there's more ample opportunities in the community for these patients to receive the BAM, we will do this in our ER. We do ask that you schedule through our coordinator so that we do not have a surge of patients sent to the ER. As we are still an operating and functional ER, seeing every walk-in patient, we're a trauma center, We're a cardiac receiving center. We're a stroke center. We're a comprehensive children's emergency department, and we're a children's hospital. We still supply every resource to this community and every service to this community. We would like to do this in a coordinated fashion and a coordinated effort to take care of these patients, and we thank you for your assistance there. Please feel free to reach out to myself or our coordinator at any time so we can help assist with this medication for our community patients. BAM is available at both Mission Hospital, Mission Viejo, and Mission Hospital, Laguna Beach.